Today's class we will see about what is genetical counseling. Why we does not go for the genetical counseling? Because currently the genetical problem, genetical diseases, metabolic related genetical diseases are more common because once they marry close relatives, some religion, some caste of the people, some nations, they are very common. So to avoid that, as a healthcare professional, we have to give the counseling services to the individuals and the families to prevent and prohibit the consanguineous marriages. So, keeping in this mind, we will see this class how we have to give the genetical counseling, what are all the aims of genetical counseling, what is the purpose, what are the things we are doing it, what is our ethical considerations, and what are all the phases and steps of giving the genetical counseling. What is genetical counseling? It is a process where the specialized healthcare professionals help the individual and families to understand the medical, psychological, and familial implications of genetical conditions and offering our guidance and support to make informed decision about testing, about diagnosis their genetical diseases and the management to come out from the genetical problem. So this is the genetical counseling. So once you explain the family members clearly, you can help them and support them, this one telling. Or simply we can tell to prevent the genetical counseling is mainly to prevent, or you can tell this is the process specialized healthcare professionals help the individual and families to understand the psychological, mainly to prevent the genetic defects in the future. That's what simple definition you can tell. Okay, what is the aims of genetical counseling? First one, to provide the family with a complete and accurate information about the genetical disorders. What is chromosomes, how it is carrying, why we are not supposed to, and help the family to the decision making involving all of them. One baby born with genetical problem, Down syndrome or anything, and again they go for the pregnancies. If your genetical counseling will be prevent them and will be advising them to go for adopting the children rather bringing the wrong negative eugenics, negative things bringing them, and clarify the family's options available to treatment and the prognosis, and explaining the alternatives to reduce the risk of genetical disorder. What all the alternatives are there to reduce the risk, and decreasing the incidence of genetical disorder, reducing the impact of the disorders. So the impact is very bad. Once this baby born, social impact will be there. They may not attend the social stigma will be coming. They will sacrifice both the parents. Any one parents will sacrifice their life for this genetical disorder baby or Down syndrome baby or whatever it may be. So many sacrifices will be going on. So keeping all these things in the mind, we created the aims for the genetical counseling. It's very important for the nurses to give the genetical counseling. The counseling mainly focusing, this genetical counseling mainly focusing on educating about the inheritance. How this gene, how it is the inheritance are passing from the one generation to another generation. What are all the genetical testing they are doing during the pregnancy, trimesters, which is trimesters, what kind of a genetical testing, what is the importance of it, if at all, how to manage it and how to prevent it, and understand the genetical risks and providing the support and interpreting the test results with them in a positive manner and connecting with the resources which is available, because all these genetical making up or genetical treating this one, the experts, it's very costly. So what all the resources are there, we have to connect it. Main key purposes are the genetical counseling. Main purpose is to understand the genetical risk and facilitate the informed decision making. Sometimes when the genetical disorders are come, nature itself will abort the baby. Understand? But sometimes the baby born or ourselves we have to, when the scan, ultrasound or the genetical amniocentesis fluid is telling this one, you have to counsel them to abort the baby. So you just need, that's the main purpose. And assessing the disease risk how long this baby will be productive to the society or to the family, or it is going to be the burden for the family. What is the psychological impact from the family? And then when economic crisis will be coming, cancer risk assessment, and to how it is more prone to get, and the prenatal genetical counseling, prenatal cancer genetical counseling test, what is the results you have to interpret. That's the main purpose for the genetical counseling. What is the indications? Same purpose and indication, like mainly to prevent the hereditary diseases in a family or the parents, and the birth defect can be prevented, and the mental retardation can be prevented, and the advanced mental age, advanced maternal age mother, mainly indication this advanced at the mother who is pregnant above 40 years, 35 years, primigravida, you must, best indication we have to go for this one. Early onset of cancer in the family, family history of cancer, miscarriages often it is happening, malformation if you are finding, tendency to develop the neurological conditions, consanguineous marriages, history of consanguineous marriages, hereditary diseases are passing from one generation, already they have Guillain-Barré syndrome or SLE or Huntington's disease. So will you advise them go for the baby? So that is what, that's the main indication. What are all the ethics in genetical counseling? So always you have to do the beneficence. Beneficence, it should be something, it should be good, non-harming, non-maleficence, do not harm them, and the autonomy. Autonomy is very important ethical decision. You can explain, you cannot force them to abort. Some of the, I have seen some of the family, they were telling, that the baby in the abdomen itself, I don't know how they missed the this genetical scan, how they missed it, I do not know. When the baby is turning, mother is having so much pain, very straight and very strange, the abdominal quickening if you see. And the doctor advised better we can abort. They told no, this is our first child, even the mild mental retardation, we don't want to abort. It's their autonomy to take a decision. So they brought the same baby and they sacrificed their living for that family. It is this one, justice. And then non-directive counseling. You should not force them. You have to do. But you have to tell them, but you cannot force them. Consanguineous, some of the religion they will tell no, it's a maternal uncle or maternal this one, they will marry. But you can tell them with the positive or negative examples what had happened, but you cannot force them and you cannot direct them. This one. Okay. What is the types of genetic counseling? The genetical counseling has been given as a prospective, retrospective. Prospective is in a futuristic approach. Retrospective, already something happened. Then they come with this one for the better prognosis we are giving. Prospective is before preventive aspects to identify the individual any particular defects and early screening. Sickle cell anemia, especially when I was working in Saudi, the most of the people from the Nigerian based Arabic people are there, their children always affected by sickle cell anemia. So we have to tell them to arrange in a futuristic way, at least arrange the marriage in a long distance relative, at least not a very close relatives or from the other breed. They can other relatives, far relatives or the non-relatives, they can get married. Retrospective, it can be done after the contraception or pregnancy termination and sterilization. That's also retrospective. Already baby born, contraception has been taken. What are all the phases of the genetical counseling? First is assessment phase. You will be doing the risk assessment in a history collections, pedigree chart you can put and estimate the risk. How pedigree chart in this one father and in your family, how many died, what are that pedigree chart will be telling, is that this one, and estimate the risk, how much the risk is there. That's assessment will be first, it will be helping, and then will be diagnostic phase. How much is there is any diagnosis, and analytical phase, and then communicate phase. After analyzing in this one, even analyzing by the diagnostic with the test like amniocentetic fluid has been taken, some of the ultrasonography, some of the genetical test has been done, and once it is diagnosed, it's confirmed about it, then you can analytical phase, and then analyze, is it how much risk and everything is there, from the history collection to the diagnosis and analyze. And once you come to the conclusion that how much the one will be passed from the one generation to another generation, how you can prevent it, you have to communication phase to the family members, both the husband and wife and other family members. And then, and what is the further steps they can prevent those risks, you have to give the referral and support. Okay, actually, the genetical counseling is really what it is doing. It is bridging the gap of the people between the genetical field and the complexity in life. So, it helps to avoid the unnecessary problem, and it is focusing with a good intention in a good eugenic to prepare the positive eugenics. So, as a nurses, we have to remember all these points and what is your approach to giving the genetical counseling. So, this may asked as a 5-mark question, or sometimes it will be asked as a 10-mark question. Thank you.